Welcome. This is the training video for the Curlin 4000 and 6000 pump. To start off with, I want to go over some of the basics of the pump, and then we'll show you how to use the pump, and then go over any issues that you may have with the pump. So the first thing I want to mention about this pump is this is the Curlin 6000 model. It is also accompanied by a Curlin 4000 model. Now, the only difference between the Curlin 4000 and the Curlin 6000 is the screen size. Everything about the pump is identical. I'm going to train on the Curlin 6000 today. But I just want to point this out that if you see a Curlin 4000 pump, it's going to work exactly like I'm showing you today. The only difference between the two pumps is the screen size. As you can see, the Curlin 6000 has a much larger screen. It's easier to read. The 4000 has a smaller screen. So the 4000 is an older model, basically. 6000 is a newer model. And otherwise, they are identical to the way they function. A little bit different coloring, but besides that, they function exactly identically on the inside from the programming perspective. So I'm going to show you the 6000 today. So if you see a 4000, don't fear, everything you're learning today will be completely relevant for the 4000 as well. So getting into the 6000 is a battery-operated pump. It requires 2 C batteries to be used. There is also an option to plug the pump into a wall. We have those AC adapters, but we use our pumps exclusively on batteries so the patients can take the pump around with them and do whatever they want to do with it. So I'm going to show you first how to install the batteries. So if you flip the pump over to the back side, you'll see there's this lock, unlock. This is the battery door and the battery compartment. Slide this over to unlock, slide that down, it comes right off. Very simple again, just slide it right down. On the back of the pump, this is where the batteries are inserted. So you want to put the batteries in on the spring side first. So you want to put it up against the spring, push down on the spring a little bit, and push the battery inside, just like that. So the second one, put it spring side first, give it a little push on the spring, slide straight in. Once you have those in place, give them a little press on both batteries to make sure they're inserted fully. And then go ahead and put that door back on. The door slides into place, just like so. Slides into place. There's 2 little grooves here that the door is sliding into. So it slides into place. And then go ahead and lock that, just like that. We're now locked. And you can check that by just trying to open it, and it's not opening, so you know that's locked into place. So a few things about the Curlin pump. The Curlin pump will be pre-programmed by the pharmacy. Pharmacists will program this pump, so it will be double-checked as well in the pharmacy to make sure that it's all programmed correctly. So when it's being sent out to you in the patient's home, you don't have to do any programming. Everything will be programmed for you. You're just going to get the pump basically running and then show them how to do a bag change. So I'll be showing you how to do a bag change later on in the video. So before we turn the pump on, I want to go over the tubing. And I have here 2 sets of tubing. And the only difference between these tubing is the one has a filter and one does not have a filter. So I'm going to go ahead and use the one without the filter today for my test. And we're going to set the one with the filter aside. Otherwise, they are identical otherwise. So when you receive medication from our pharmacy at OSO, the bag will come pre-spiked. I have here just a hydration bag. Basically, the bag will come pre-spiked already with the tubing inside of it, and will already have primed the line. So it's very easy for the patient. They just take the bag out of the refrigerator, put it on the pump, and start it. So what I'm showing you will already be done by the pharmacy, but it's good to know this anyways. So in order to open this up, I'm going to go ahead and just open up the tubing. Tear it open like so. Dispose of all the trash. Try this open, try this open. So first thing to notice about this tubing is this is called a cassette. It's just called the tubing, but this is the part that goes into the pump. You'll see this little tab right here. This tab is a flow stop. Right now, the flow is open. When this tab comes with the tubing, right now, it is open. And it makes that easier for priming, basically, for the initial priming. So what you're gonna wanna do before this tab goes into the pump is you actually break this tab away. It's called a breakaway tab, so it just literally breaks away. So you just basically put your hand on it. You can bend it any way. It's easiest to bend it like this. It'll snap right off. So it's a breakaway tab. It's supposed to snap off, so I'm going to snap it off. Snapped off just like so, the little piece. You can now discard this piece. And what that did is that also closed this. So this is now closed. So that little tab was basically holding the spring open, which is keeping the line open. Once we remove that, it has now closed the lines. The line is now closed. There is no flow going through this line. So let me just go ahead and spike this bag really quick. So bag opens very easily, of course. And again, the pharmacy will have done all of this for you and for the patient. So there's a little cap on the end of this bag. We go ahead and just pull that cap off. That's just a little safety cap. We then go to the spike. Here is the spike. A little cap is on the spike as well, so you just can remove that. You can then toss that. And the spike goes into the bag, just like so. So we got this little receptacle with the spike, and you just spike it in there. That's why it's called the spike. So give that some good twist action and make sure that's fully pressed in there. So as you can now see, that is now spiked into the bag. I'm just gonna set the bag over here. And we now have a flow stop, so there is no flow of the hydration coming through the line at the moment. Last piece to remove is the little cap. This can be used for if the patient needs to disconnect for any reason. They want to go ahead and cap this off to keep anything out of here. But otherwise, most of the time, this cap will be disposed. We send extra caps to the patient if they ever need to recap a bag. So the next part I want to look at is putting the tubing into the pump. So in order to put the tubing in the pump, you're going to need to open the pump up. So look at the top of the pump, it says lift to open. You're lifting this little metal tab right here. So I'm just putting my finger, just sliding my finger underneath here, and it lifts right up. So once you lift that up, the top of the pump opens, and this is where the tubing goes. So two things to point out on this. You see this yellow arrow. This yellow arrow corresponds with the yellow piece, and there is a blue arrow on this side. This blue arrow corresponds with this blue piece right here. So in order to put this in the pump, I'm gonna hold it just like this so you can see. You can start with either one, the yellow or the blue. I recommend starting with the yellow, it's just easier. The yellow piece just slides into place. There's no snap or click, it just goes ahead and just sits right into place. So you sit that in place. You then run the tubing through the pump and take special care to run the tubing through the center of the pump. But when I say that, this is correct. Running it like this would be incorrect. Now the pump should still function, it's designed to still work, but you may have unexpected alarms when you're running the tubing like that. I've run it, like this before, and it's been fine, but it's recommended by the manufacturer to run it right through the center. So once you run that through the center, the next part is to take the little blue tab, and there's a little blue slot for it. It just goes in the blue slot. And there's no snap or click, it just simply presses and goes into place, and then give it one little press to make sure it's down in there. The next thing to pay attention for this tubing is when you're putting the tubing through the pump, make sure it is on this side closest to you. So I'll show you why in a moment. When you close the door, there's now, the tubing is free. And if you were to put this in on the incorrect side, which is the back side, so if you put this through on the other side of the door, when you go to close this door, we are now pinching the tubing. You're gonna get an occlusion alarm. This is basically the only wrong way to install the tubing per se. Otherwise, it's pretty straightforward. You can't install it incorrectly. So this one, you're gonna know you're gonna get alarmed right away. So if you put it in this way, this is the wrong way. It is pinching the tubing. It still will let me close it. It's really forcing it closed. So I could see somebody doing that, but it's not gonna work. So go ahead and put that in the correct way, and that's on the front of the pump. So that goes in just like so. So closing the door is very easy. Basically just close it, and then while you're pressing down, so press down on it, you press this, and it'll latch into place. And you know because it is flush. It is flush on the top. So again, if I were to close this and leave it like this, you can see how there's a bump here. You have not successfully closed it. It needs this last little bit, so you push down on the top of it and then push down on this piece right here. So if you just try to, you can do it all in one. There's all in one, but I do that just to make sure that you do it all correctly. So press down and press down. If it's flush with the top, you are correctly latched. So now we have the batteries installed, we have the tubing installed. Let's go ahead and turn on the pump. So again, the pump will be pre-programmed by the pharmacy, so there won't be any programming involved. The most you'll have to do is review the programming to make sure that it's correct, just to triple check at this point, and then start the pump. So right now it's going through a self-check. Basically the pump's a little computer in here, so it's going, is there anything wrong with me? If there's anything wrong with it, it'll start alarming to say what that is. Otherwise, it will be, moving around so much, otherwise it will just start right up. So the pump is started right up, and this is basically programmed. So this is the only startup screen you're gonna need. I'm just gonna go to a different one just so you can see you don't need biomed. It always turns on to this program, and program basically is the programming. So you're gonna go ahead and say, yes, I wanna go into the programming. This is always the same no matter what. So yes, I wanna go to the programming. It has two options now. It has repeat RX and it has new program. So new program, self-explanatory, that's if you wanted to put in a whole new programming. We rarely, if ever, want to do that, so you're never going to do new programs. So that leaves you only with repeat RX. There is a missing option in here. There would be resume. Resume would have been if it got paused and we turned it back on, or paused it, it would go to a resume, and we would resume it obviously be to resume the same bag. But right now, since we're doing a brand new bag, we're starting a new bag, it's saying repeat RX. And what repeat RX means to you, or a translation for the patient is new bag. So whenever a new bag is going on, you want repeat RX. So that's pretty much, we have repeat RX, new bag, or resume. So the new bag and resume is pretty much everything that you're doing with the pump. But repeat RX is the terminology the pump is using. So that's your new bag option. So I'm gonna go ahead and say yes, enter. And when I say yes, enter on repeat RX, what it's gonna do is it's gonna automatically scroll through the programming and show you the program values. This is the quickest way to verify the programming. So at this point, if you have a medication label, normally, I don't have one right now, but normally we'll have a medication label on the bag that will show the programming. It'll have the bag volume, it'll have the rate, it'll have the dose timing, the dose amounts, it'll have all the specific details from the pharmacy. So what you can do is you can verify that via that. And there's also some information that we send out with the programming as well. So what I'm gonna do is I'm gonna click on this and it's gonna show the programming automatically. I can stop it at any time. So if I wanna view it more thoroughly, but otherwise it will continue to cycle through. I'm gonna let it cycle through for our demonstration. So I'm gonna say yes to repeat RX. It is now cycling through. It's showing units and mil delay. So here's our programming, bag volume, amount dose, dose rate, dose duration, dose frequency, KVO, dose bag, required volume, and total time. So if you ever wanted to review that information, this no to review. So when it's saying run no options, those correlate to buttons on the screen. Run no options, sorry. Runs over here, run no options. So I'm gonna do no, and that reviews it really quick. Unidentified, basically the pump is designed to be programmed into it what the drug is. We don't necessarily always program what the drug is into the pump. For my testing, I haven't programmed anything, so this could say what the drug name is. Most of the time, it'll be unidentified. If it's required to have a drug name for a label, we'll put a label on the pump that'll say what the drug is. So I'm gonna go ahead and continue through. So continuing through, it's in milliliters is the units. There's no delayed start. A delayed start's basically if the pharmacy wanted to program a delayed start, let's just say it's 4 o'clock right now. The first dose doesn't start till 8 o'clock. The pharmacy can program a delayed start so that the pump, once it's started, we can start it anytime. You can start it at 6 o'clock. And once 8 o'clock runs around, it'll start automatically, start giving that first dose. So that's what a delayed start is. Most of the time we don't program one, but if there is a reason that we know, hey, the dose needs to start at 8 p.m., they'll program that in there so you can hook the patient up, start at any time. When 8 p.m. rolls around, it starts giving the first dose, they're back on schedule. So moving down, we got next yes, and for yes, I have to press yes. And this is the specific value. So this is programmed for 300 milliliters. This is the dose, so the amount for the dose is 47 milliliters. The dose rate is also 47 milliliters an hour, and that's because it's over 1 hour. So 1 hour at 47 milliliters is 47 milliliters an hour. That dose frequency, this is how often the dose happens. So if this dose is every 8 hours. So basically every 8 hours, it's gonna give 1 dose. So every 8 hours, it does 1 hour dose time. The 1 hour is included in that. KVO rate, that stands for keep vein open. Basically the pump runs at a small amount in between the doses just to keep the line moving so it doesn't get clogged up. Dose per bag, there are 6 doses per bag. This is automatically programmed, which is calculated to tell you there are 6 doses per bag. This is the volume required for 6 doses, and if you saw earlier we had 300, so we have enough volume. This is telling us the total time it'll take. So this is a 2-day bag. This is a 48-hour bag. So when we start this, if we start this at 6 p.m., 2 days later at 6 p.m., it's gonna say, hey, I'm done, I'm ready for a new bag. Done, yes, I'm gonna go ahead and say yes. So this one's programmed on the intermittent. That's what that program is called, the intermittent programming. So let's go ahead and run it. So basically for a patient, we need to prime the pump. So we just put up a new bag. For this example, the bag was not primed. The pharmacy will prime it for you, so that does make it easier. But let's go ahead and prime it so you know exactly how to prime it. So I'm just gonna take my little end cap here and I have a red cup. I'm gonna put it in a red cup over here and go ahead and prime it. So to prime with this pump, it's very easy. You go ahead and press this prime button once down here, prime. It says disconnect the patient, release any clamps, and hold prime. So for a clamp example, basically this pump has this little white slide clamp. If you ever need to disconnect the patient or do anything that you want to close the line, it's this clamp right here, and it just basically slides closed just like so. So you just kind of slide it down the thing, and you have now closed the line off. So that's how you effectively clamp the line for this pump. So I'm gonna go ahead and release that to make sure that's released for priming, and go ahead and put that back in my cup. All right, let's go ahead now. So it says hold prime key, so go ahead and hold the prime key. So we're holding the prime key, and right now it is priming. So if we were able to see I can see the medication flowing through. You'll see here in a moment on the left side. There it goes, so it's now priming. So you want to go ahead and prime all the way until it gets to the very end, and you want to watch for maybe 1 or 2 drops to come out so you know it's primed all the way. So I'm watching my cup, and once it's primed all the way, I'll go ahead and stop it. So you can just take my word for it that it's priming through the line right now. It's snaking its way down. It is almost there, and it takes about that long to prime, and we got 1, 2 drops. So it says prime to continue. If you need more priming, you press prime again, or yes to exit. So I'm gonna go ahead and yes to exit. So prime amount, we just primed 3.2 milliliters. So the pump is calculating that, hey, there is now 3.2 milliliters less in the bag because we just primed that out. The patient didn't get this amount, so it knows that, hey, this got taken out of the bag, and that'll be important possibly later. So go ahead and say yes to exit. We're done exiting. So now we have the pump. We have the new bag. We have the bag hooked into the pump. We have it primed. At this point, we could hook the patient up, get the patient hooked up to the line. If there's any extensions that need to be hooked up to the line to the patient, you go ahead and install the extensions. You might do some more priming if there's an extension involved. So put the extension on, do some more priming. Once that's ready, we can go ahead and start the pump. So I'm gonna go ahead and press run. So right now this alert is popping up and is saying that the amount to be infused is greater than the bag volume. So basically, because we primed that 3.5 milliliters out of the pump, it's saying, hey, you programmed me for 300 and the pump needs 298. I'm missing 1.7 milliliters worth because I primed that out of the pump. That's a reason why we would also prime the bags ourselves to make sure the patient's getting the full amount. This usually isn't an issue. We're talking about 1 milliliter at this point. 1 milliliter's, you know, what it's notifying you that it's missing. So we know that one milliliter is not an issue. The bags are normally overfilled at our pharmacy. So no matter what, there's a little bit of overfill. It depends, it's a percentage basically, but there's 10 to 20 milliliters extra in the bag anyways, and that's usually for KVO, so it's not an issue whatsoever. The pump will still finish the infusion as it's programmed. It's just saying, hey, you're short, and we know we're short. We just did some priming. So I'm gonna go ahead and say yes to continue. Normally this won't come up if your bag's already pre-primed and if you're doing no priming. So normally this message won't pop up and it'll skip this and go straight into the next screen. So the next screen would be starting. The pump would just start. So as we see it, we've started the pump and it's going through some different pieces of information. It's on dose 1 of 6. The rate's 47 milliliters an hour. It has a remaining amount of 298.7. Here's your infusion volume. So it's given 0.2 so far. And it just goes through basically pieces of information at a time. Dose 1 of 6. This is your line pressure. This is how much back pressure the patient's line is having. If that's an extremely high number, that means there's blockage in the line somewhere. So right now it's at 10. 10's as low as it goes. We know there's no resistance whatsoever right now. If I was to kink the line or put a clamp on the line, you'll see that start climbing up. Once it hits about 300 or 400, it'll alarm and say, hey, there's too much pressure, there's something wrong, go figure out what's wrong with the pressure. It has the next dose, so it's telling us the next dose is 8 hours from now. It's got how much is remaining time on this current dose and line pressure. So it just cycles through some information. So one of the ways you know it's running also is it has this little run that's blinking green, if you see right here. So we know it's running because it is blinking green on run right there. And that is about as much of the intermittent as you're gonna need to know. Really quick, I'm just gonna pause it. Just show you those two options again. Here's that resume, repeat RX. So if you need to pause it to do anything, if the patient wants to take a shower, they want to hook the pump, they can pause it, they can turn it off, turn it back on, and it'll resume exactly where it left off. So they can do that basically at any time. I highly recommend that they do not pause it and take it off during doses. They should complete the dose, finish the dose. Once the dose is complete, during that wait time, during that 7-hour window in between the doses, they can go ahead and turn the pump off, pause it and turn it off and do whatever they need to do. Take a shower then, but do not pause it and stop it during a dose. So go ahead and you can resume it. So to resume it, we're back to this, what I call run to start screen, and we could go ahead and do run again. This is that same alert. Yes, we know, we primed a little bit out, and you can say yes, and we're back to running. And that is basically getting the patient set up. So that's all the patient really needs to know about the pump. They turn it on, they say yes to the program, and they go ahead and run the pump. So I'm gonna go ahead and pause this and turn this one off. There's another therapy type I'm gonna show you right now. The next therapy type is a continuous therapy, and that is basically a therapy where the patient's receiving a set amount of medication at one rate. Say they're receiving 200 milliliters at 125 milliliters an hour. This is also going to show me how to do basically a new bag. I have a program for a very small amount so that we can run through a whole bag basically and do a simulated bag change. So let's pretend we're a patient right now. I'm turning the pump on. And the pump is going to go through its self-check. I'm also going to show you some of the alarms during this test as well, so we can simulate what some of those occlusion alarms look like. Okay, so same thing here. You see in this pump we have library. Library was not another pump. It doesn't matter. It's irrelevant. You always just want program. It'll always default onto program in the first place. So program, yes, enter. You want to say yes to enter into the program. So yes, enter on program. Again, since it's a new bag, it only has the new bag option, repeat RX. I'm going to say yes to that. This one, I'm not going to stop it. We're going through basically the same thing here, as you can see. Has a maximum rate of 400 set up. Bag volume not being infused, rate 400. So same thing, it was showing you those values. Same thing, if you want to go back and check them again, you can do no change. I'm actually going to do that just to change one of my rates. I wanted to start at a slower rate and then increase the rate as we go to show you another feature of the pump. And I'm going to hide this from you really quick. And that is the code. All of our pumps come from the pharmacy locked so that the patients can't make any changes. If you need to make any changes, you should contact the pharmacy and we can walk you through making those changes. And when the code comes up, we can walk you through entering that code. So that's another benefit to this pump, is that it locks it out so the patients can't go in there and they can't change anything or mess anything up. It is locked in place as is. All they can do is drop it and break it and get a new one. So let's go ahead, and this one's already primed, so it's already primed for you. So what I want to do is I'm going to go ahead and just run it. So we've got basically, the new bag. We put the new bag on, installed it, turned the pump on. It's already primed, as the pharmacy has already primed it. We can just verify that by looking at it. If we want, we could prime just 1 milliliter to watch it drop out the end. I'm going to go ahead and assume, or in this example, I know it's primed, so I'm going to continue on. Next thing I want to do is to run it. So I'm going to go ahead and start this pump. And we're running at right now a continuous infusion at 100 milliliters an hour. So basically, it's just going to run at 100 milliliters an hour until it's given the 5 milliliters I programmed for, which is not a lot. But I did this because I wanted to show you some of the alarms. So the first alarm I want to show you is the upstream occlusion alarm. And basically, this is an alarm that occurs between the bag of medication and the pump. It's a very short run of tubing, so it's very obvious of where that issue lies. But if I were to kink the tubing, which I'm going to do right here for you, I'm just going to go ahead and kink it between the bag and the pump, and it's going to go, hey, I've got an issue, alarm up occlusion. So it's saying, hey, I have an alarm. Whenever the pump has an issue, it's going to alarm and then say what the issue is. So it's alarming and it's saying up occlusion, and up means between the bag and the pump. So with this alarm, I'm going to take it away. I've taken away the kink. For this alarm, you have to stop the pump. Normally you don't get up occlusions, so I'm going to go ahead and just silence it. There we go. So normally you don't get up occlusions. It's a very small run of tubing, and it's not the, so a lot of times the patient's line gets occluded or clogged up and needs to get flushed, and that's the solution. For this one, you rarely get these. The most common reason you're getting this is because you installed this piece incorrectly and it's in the back here. And it's saying, hey, my tubing's kinked. Otherwise, it's a very short run of tubing. I'll just show you really quick on this one. It is this run of the tubing. Of course, it's wrapping around itself. Right here, the total length of it is this. So it's a very short run of tubing. There's not a lot that can go wrong with this piece of the tubing here. There's also no clamps on it. So if you're getting it up in occlusion, those are the rare ones. So go ahead and stick that back. So let's look at, so what you do for the up occlusion, you have to pause the pump. We're back to this resume repeat RX new program. You say, yes, I want to resume it. And then yes, let's go ahead and start it. Now, the other occlusion, the much more common occlusion alarm, is the down occlusion. The down occlusion can happen because let's go ahead and simulate one. So basically, I'm now kinking my line. Let's just say I'm in bed and my line's all twisted up and it's finally gotten too twisted. Look at that line pressure, 870. So I'm going to silence it so it stops making noise. So this is the downstream occlusion. This is basically saying, hey, somewhere down the line there's an occlusion. This can be twisted tubing. It can be that white slide clamp is still closed. Or it could be basically a clog in the patient's line. which means our line needs to get flushed. I've also seen the position of the arm cause an occlusion. Basically, if the arm is fully bent, like for example, say you're talking on your cell phone, if you were to bend your elbow up and hold your hand, okay, let me get that to do that again. There we go. That can also cause the occlusion. Now, the nice part about this down occlusion is as soon as the occlusion goes away, the pump automatically starts again. So that's nice because if it's just a simple twisted tubing and you untwist it, it'll start running again. So this one needs minor interaction from somebody to get it fixed. You just need the occlusion to go away and it'll fix itself. So for this example, as you can see, I have it just fully, bent in half. As soon as I let go of that, the pump goes, oh hey, the occlusion's gone, and starts running again. And you can see it running again. Line pressure is going back to normal. So for this one, the most likely cause of this occlusion is because the patient's line is occluded and it needs to get flushed, basically. That's the most common resolution to this alarm. Let's go ahead, and what I want to do is, while this is running, there's another feature for this pump which is called titrating. And titrating is basically changing the rate on the pump while it's running. So some therapies require the rate to start at a slow amount and then to be slowly raised incrementally as the infusion goes along till you get to the maximum rate. So right now we're running at 100 milliliters an hour. I'm gonna go ahead and increase this to 250 milliliters an hour so we can look at how to do that. So the pump must be pre-programmed in order to do this. The pharmacy, if they know this is the situation, they will pre-program the pump, but it needs to be pre-programmed to be able to do it. So how you do it is you go to this options. While the pump is running, you go to options and you press this down arrow button right here. So I'm going down, down, down. And what you want is med limits. It is med limits. That means change the rate. I don't know why they want med limits, but that means change the rate. So to change the rate, you press this no change button. It's gonna ask for the code again because the pump is locked. That's something the pharmacy can provide you with. Okay, I've entered that. Now when I say no change, it changes it to on. So I press no change, it went to on. I'm gonna say yes, now I wanna go into it. So right now the rate is 100. Let's change it to 250. I'm gonna say yes, and we're gonna say yes, and we're gonna say yes. The pump will now automatically change to 250. Waiting for the top, it's gonna finish really quickly. There's 250. So the reason I did this as well, I wanted to show you a simulation of basically what happens when the bag is empty, when the patient's completed a bag and they're ready for their next infusion, their next bag to start again. So currently it's at least silent. I was gonna press silence, but so here's the screen that I wanted on. So this screen says infusion complete. As you can see, it's infused 5 milliliters. Normally that would be 300, what the actual amount is. And right now it's running on our KVO mode. And it runs on the KVO mode at the end of the infusion to still keep the line moving so that when you put on the new bag, the line isn't all stopped up and hasn't been stopped up for 8 hours or however long it's been between bag changes. So it can continue running on the old bag at this KVO rate, or as soon as you get this screen, you can actually change the bag and start the pump again. And it'll run on KVO until it's ready to start again. The pump basically has let me get the lights turned back on. The pump has an internal clock in it, so if we're dealing with an intermittent situation, it will always know that, hey, if my dose isn't due to start until 6 p.m., it will not start the dose until 6 p.m. If we do the bag change, at 4 p.m., 3 p.m., 1 p.m., the day before, it will know, hey, I'm not due to start for another 6 hours, and it will wait to start for 6 hours. So you can do the bag change anytime on the intermittent scheduling as soon as the bag is done. You don't have to wait the 7 hours before the first dose is supposed to start. You can do the change right away. But this is a continuous, so this one, as soon as the bag is done, it's done, you're ready to put on a new bag and start it again. So let's go ahead and go through the simulation of, I'm an intermittent patient, I just finished my bag, I want to put on a new bag, what do I do? So at this point, you go ahead and pause the pump. And you can see there we have 2 options. We have repeat RX and new program. So repeat RX means what? New bag, exactly. So they're putting on a new bag. You say, yes, I'm putting on a new bag. Go ahead and do that. It's gonna go through the automatic review again. So it's going through the automatic review right now. Just gonna let it go through that. And we're back to our run to start screen. So at this point, what we would do is we would go ahead and take the old tubing out. I'm gonna just simulate that, take the old tubing out, put the new tubing in, go ahead and close it again. At this point, I would recommend doing a battery change. Anytime you change a bag, you should change a battery. That is our policy. Normally, a set of batteries will last much longer than a bag, but just to be safe, we do a battery change whenever we do a bag change. So whenever you're changing the bag, change the batteries. So this would be a point you would change the batteries, change the bag, get it to this screen. If there's any extensions, put the extensions on, do a little bit of priming, and then we're ready to start the pump. So in this one, I'm gonna go ahead and start the pump at this point. So I started the pump again, and we are off and running. So we've done a bag change, we started the new bag. In this situation, it's giving the dose right away. If this is an intermittent and the dose wasn't due yet, it would be waiting. It would say delayed start for another 6 hours, however many hours it is, and then it would start giving the dose and be back on schedule, or still be on schedule. And that is most of that. A few other things on the pump. It is equipped with a few other alarm codes, alarm situations I want to talk about. So basically, anytime there's something wrong with the pump, anything wrong that happens, it's going to alarm on the screen. It's going to alarm, it's going to say what it is. So another alarm that happens, for an example, is it will alarm and it will give a code and a number. For example, it'll say alarm code 35, alarm code 112. So those codes correspond to what's wrong with the pump, and we have the information here that says what those are. But if you're receiving that sort of a code, you need to contact the pharmacy and we just send out a new pump. Those codes can range from many things, from the internal battery having issues, the internal motor having issues, some sensors having issues, to being a simple thing as a key being stuck. If your one key gets stuck, you hear this press that I'm doing. That's the sound that's making as I'm pressing the key. Sometimes this can get stuck from various reasons, patient being too rough on it or this or that, to where if this gets stuck, they may not know that it's stuck. And basically the pump's gonna know, it's gonna alarm and say, hey, I'm having this issue. So most likely if you're getting a code, anything with any two numbers, we do a pump exchange. We'll send out a new pump. That's why there are reasons, or you could possibly still be using the pump to finish out the dose. Like if it's a stuck key one, you can continue to use the pump most likely. But for any of those situations, we do want to get the patient a new pump, and we'll get the other one back and then service it. That's most of the codes for it that it's going to have. And that completes our video of the Curlin 6000 pump. Again, the Curlin 4 and the 6 are exactly identical. Anything I showed you in this, you'll be seeing the same thing in the 4000. Thank you, and then we'll see you for our next video.